So, one of the professional leading bodies of the doctors in Zimbabwe, calling themselves the Zimbabwe College of Public Health Physicians, have actually called on the government of Emerson Mnangagwa, which declined 367 million US dollars that was aimed at supporting the health system of Zimbabwe. The doctors have actually urged the government of Emerson Mnangagwa to consider re-engagement and thinking twice about the decision to just let this money go, citing numerous consequences if this money slide away from the government. Of course, the government of Emerson Mnangagwa made announcement that it was stopping this financial support because of the strings attached to it, which the government of Zimbabwe says it actually weighed on the sovereignty of Zimbabwe. But will the people actually be treated with sovereignty? Greetings and welcome to your lovely channel, the Hloniphani Global News. If you are watching us for the very first time, please do remember to press the red or black subscribe button so that next time when we beam live, you become the very first one to watch. So Zimbabwe's senior doctors have urged the government to reopen talks with the United States after negotiations over a proposed bilateral health funding agreement collapsed, warning that the abrupt loss of American support could carry serious human cost. The United States Embassy in Harare said on Tuesday it was winding down health assistance to Zimbabwe after President Emerson Mnangagwa ordered officials to withdraw from the negotiations on a memorandum of understanding which promised 367 million in support. The Zimbabwe College of Public Health Physicians, that is ZCPHP, the country's leading professional body for health specialists, said the timing of the breakdown was particularly worrying, given Zimbabwe's continued reliance on external funding for key components of its health systems. An abrupt discontinuation of such support could risk treatment interruption, increased transmission, the emergency of drug resistance, and additional strain on the health system, the college warned in a statement. The ZCPHP said critical pillars of Zimbabwe's HIV response, including antiretroviral medicines, laboratory commodities, disease surveillance system, and supply chain support, remain heavily dependent on external financing, particularly from United States government programs such as the President's Emergency Plan for AIDS Relief, that is PEPFAR, while acknowledging progress made by the government in recent years. The college cautioned against a sudden withdrawal of support. Zimbabwe has recruited more nurses and frontline health workers, strengthened primary health care delivery, and achieved the UNAIDS 95-95-95 HIV targets. The gains reflect strong national leadership, sustained domestic commitment, and years of effective collaboration with development partners. The ZCPHP said, adding that dismantling the funding architecture without a managed transition risks reversing hard-won advances. The doctors urged both government to re-engage constructively, arguing that many of the contentious issues were technical rather than ideological. Concerns around data governance and implementation frameworks can often be addressed through technical clarification and negotiated safeguards. The college said, offering to provide independent technical expertise to support renewed talks. Health financing transitions are most effective when they are predictable, phased, and technically supported. It aided the intervention through a sharp rebuke from President Mnangagwa's spokesperson, spokesman, that is George Charamba, who accused the doctors of overstepping their mandate. What they have, this is George Charamba speaking, what they have done is to injudiciously pronounce themselves in respect of a matter which is beyond their knowledge base. Charamba said, if they have anything constructive to give, they must give it through their parent ministry. Government officials say the proposed memorandum of understanding promoted by Washington was the future framework for U.S. health assistance under its America First global health strategy. Was unacceptable to Zimbabwe. According to Foreign Affairs and International Trade Secretary Albert Chimbindi, Mnangagwa directed that Zimbabwe must discontinue any negotiation with the USA on the clearly lopsided MOU that blatantly compromises and undermines the sovereignty and independence of Zimbabwe. Officials said the agreement would have granted the United States extensive access to Zimbabwe's health data over an agreed period, a provision Harare viewed as an intelligence overreach. The U.S. offer also linked health cooperation to access to critical mineral resources. Government spokesman Ndabaningi Mangwana said Zimbabwe valued its long-standing relationship with the United States, but insisted any partnership must be equitable. At its core, the arrangement was asymmetrical. Mangwana said Zimbabwe was being asked to share its biological resources and sensitive data with no corresponding guarantee of access to medical innovations such as vaccines, diagnostics, and treatments that might result from that data. This is not a rejection of partnership, he added, but an insistence that partnership must be genuine. The ZCPHP framed the dispute as more than a bilateral issue, warning that weakening Zimbabwe's health system could have regional and global implications. A stable health system in Zimbabwe continues to broader efforts to prevent and contain infectious diseases. The college said sustained cooperation grounded in mutual respect and a shared commitment to public health remains the most prudent path forward. So this is the advice that the Emerson Tambuzo Mnangagwa has been given, but you can see how stubborn they are, the likes of George Charamba. As long as they're eating, as long as they are well taken care of, they don't worry about the majority of Zimbabweans who stands to suffer from a government that cannot support the health system. Thank you very much for watching us. If you're watching us for the very first time, please do remember to press the red or black subscribe button so that next time when we beam live, you become the very first one to watch us. Okancubu Mhlabane is signing out. Let me love and leave you. Let's meet on the other side.